We're going to call the meeting to order. If we could stand for a moment of silence. And then I'd ask the sheriff if he would in a moment to give us our pledge. Sheriff?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. So this is a special called meeting, and one of the things I wanted to bring up at the start of it, and any board member jump in at any time, because I know the last week, and especially the last 2 days, and especially today, up until this last minute, we're getting a lot of phone calls and a lot of emails. Personally, I appreciate those because it's given me different perspectives of parents and teachers and staff members. But there was some somewhat misconception of some of the folks. I think our board, and correct me if I'm wrong, decided to meet every couple of weeks while we're going through this for a couple of reasons, not just to talk about opening schools, but to discuss the current issues. Like tonight, there's some things facing the staff that need to be dealt with by our board, and we're here to support you. We're here to make sure that we can help you make those decisions if it needs our approval, to see what's going on, to get an update on virtual learning. So these meetings are much more than just a discussion on do we go back to school or not. They're a whole variety of things, and we've got several things on the agenda. So we're really here for multi-purpose, and I think we've decided that we're going to meet about every couple of weeks, every 2 weeks, in a called session until we get through this crisis that we're in. Is that how everybody kind of understood?
Well, yeah, meet and discuss it and talk about it. I mean, because I'm getting phone calls and emails. Parents, grandparents. I had a great grandparent call me today, almost crying. They cannot do anything. Can't help them. So we've got to do something.
So I think that's what the purpose of our meeting is, as I picked it up when we talked the last, was we were going to try to meet so that we could discuss these issues.
I think it's a good idea myself.
Okay.
Yeah.
So I just, anybody, I just wanted to make that kind of clear because I think there was some confusion from some of the people calling that, tonight we're fixing to open up schools, and I don't know what our decisions are going to be tonight, but I just want to let everybody know that we're here for much more than that. And I personally appreciate the input that people have given because it's given me perspectives on both sides of this realm.
As well, yeah.
Okay, all right, so I just wanted to make sure that we were all on the same wavelength and that people understood why we were meeting. So we'll try to meet again, if you can send that out to the board in 2 weeks and see where we're at,
When's our
regardless of
regular
what we do
meeting?
tonight.
Our scheduled meeting is probably about that.
It is actually, it'll be 2 weeks and 2 days. So we actually meet again in 2 weeks for our regular
Okay.
meeting on the
Okay.
10th.
That'll work.
All right.
Will that work?
We'll schedule.
That'd be good.
Yeah.
Okay. All right, so the first item on the agenda is the discussion and approval of the Johnson County School System opening plan reassessment due to COVID-19 numbers. So Dr. Simcox, if you would, let's discuss that.
Yeah, do you care if we do a roll call first?
Oh, I'm sorry. I got a little ahead of myself. Okay, call the roll.
Mr. Carlton,
You here?
Mr. Long,
Here.
Ms. Reese,
Here.
Mr. Payne,
Here.
Mr. Matheson,
Here.
Okay.
Okay.
Now, if you would go on and talk about this, where
Okay.
we're at right now.
To start with, I will, Wendy has put some information at your seats with a case count. I know Mr. Carlton had asked for that today. And so I'm going to sort of let Wendy talk about our cases right now versus not only with our students, but with our staff, where we're at as of today. And then we do have some new information on isolation and quarantine that I think she's going to address. So would it be okay if we started with that
Sure.
to start with?
Wendy?
Okay, I guess I'll give you the numbers first, and then we'll go over these things that I kind of put in front, because I just put those there so you would have just a general idea of kind of where we're going. So.
Let me also announce, Wendy is,
She is our school nurse license practitioner, and she is our go-to at this time. I will say Wendy she probably is the hardest working person in the school system, because she not only keeps up with who has COVID, who is quarantined, who needs to be isolated the day they can come back. She keeps up with all that. So, bless her heart, she has a very tough job right now.
okay, I just wanted to introduce you, Wendy, for
Okay.
people who are online that didn't know who was talking.
And I too have took a lot of calls and questions, and I'm more than happy to answer them because it's very confusing, and I just want people to understand it. So what I have, just based on our county, pretty much since we started coming back together around August 3rd, we had 50 staff involved since August 3rd. And we know that was a little bit before we actually came back to schools on August 17th. But since August 17th, when we opened up virtual school, we have had 43 staff at some point in contact or whatever. But 25 out of the 43 has either been positive or symptomatic. So 43 has either had to be in quarantine or isolated because they were exposed. And so 25 of those were positive or symptomatic, and 31 would be quarantined if you want to separate the 43, okay? On the student side, it's mostly been athletics, because that's who's been practicing, and we've had a few students come into our computer labs. And on August 3rd, we had approximately 26 students, just variety of things, and if you add our football situation, that would be 46 students. And currently out right now, we have 12 faculty that are in quarantine, some of those up to at least September 3rd, with the furthest being out September 14th. And 17 students who cannot return until September 1st.
Is that because they're positive, or they're symptomatic, or they have exposure?
Both. We have some students positive in that 17, and we also have some faculty present or positive in that 12.
So that, the quarantine's under the governor's new guideline, 24
Yes.
days.
And then I want to go over that next, because the new guidelines did come out Monday, and it's just kind of stems from there. Do you have any questions about those numbers before I go to the next thing?
You have one that says percent positivity.
Are you looking at this graph thing?
Yeah, I'm looking at your graphs.
Okay. This is just kind of different. This is actually August 12th statistics from our last conference call with Dr. Kursky. It's the newest one. It's the only updated one we have. But I just gave you that to show you that Johnson County has been the highest out of all the upper east counties. And
Where are you getting these figures from?
this comes from Dr. Kursky at the Northeast Regional Health Office on our conference calls, and Dr. Cynthia Thomas. They present.
Are the inmates in these numbers?
I'm not sure about that, to be honest.
Because of Washington County having the highest numbers of COVID in the upper East Tennessee area, I don't see why their chart graph shouldn't be higher than Johnson County.
I'd say it's the county, I'd say it's everyone included that they've been able to track.
This
And-
is numbers per 100,000, right? And it's a percentage
then-
per 100,000, I
Percentage,
think.
yeah.
And then the second slide there is, their test rate that they had saw coming through the health department. The second sheet there that Mr. Carlton was talking about is the percent And then the very last page is kind of breaking it down for age, so maybe that will help determine that. Of course, if you look on that, that shows age 11 to 20 is the highest. And then that last slide also, we was very high on August 5th. We've slowed down since, but we have still seen some.
Students would be approximately 25% of the people who are in this case.
But just keep in mind, the only reason I put those there was just to show you Johnson County has been the highest, because I know some of the other counties are reopening and doing what they feel they need to do, but, I don't know why that we're, higher in that range, but this is without students being together. And this is also still before we had teachers coming back together.
Right.
Okay.
So stay on your numbers for just a minute for all of us, if
Okay.
you would. You and Dr. Simcox, can you tell us, I know Doe School had some issues, School Bus Garage had some issues.
Yes.
Can you talk about that for just a minute for us?
I can. So that is part of the August 3rd. That's why I went back to August 3rd. We had some incidents where, people were still wearing their masks, but we had some pretty close contact of someone that was asymptomatic prior to 48 hours and who was in contact with multiple people at the bus garage. And then we did start putting them in quarantine, and then we had several develop symptoms and become positive within that time frame. And then a lot of those started coming back to school from their quarantine, and then we opened up our classrooms for the virtual teachers to come in. But they're still wearing their masks too, and they're in their rooms, but still, we had a couple of days that we did the handing out of the Chromebooks and the books underneath the awnings, and then that's whenever those situation presented.
Well, that doesn't mean that they got it from the school or
Right.
their contacts at the
But
school.
we potentially had some positives there. We had to follow the guidelines of quarantining some there, and we were in both of those situations because of unsymptomatic personnel. And then, as people developed their symptoms, they called and we kept them out as much as we could. And this could potentially have been a lot higher if there was several teachers and assistants who called before coming to school because they, got sick that night and called about 6 o'clock in the morning wanting to know what to do. And so we was luckily able to stop them from coming in that could potentially, cause more spread. And then we had basketball practice. And again, an asymptomatic individual got sick that night after practice was held. So then I had to put everyone in quarantine because that's close exposure, everyone touching the basketball. So then that's what happened there. And then, it's just general things that's happened, there's been some kids that's been in sleepovers and things like that that's got back to me. That's where some of the spread has happened. So it has been when kids are coming together in groups still, and even the faculty, of having to be quarantined.
Well, there have been several, I know from the calls that I've gotten, there have been several businesses that have had quite a few positives in town. I don't want to point anybody out, but so that's, another way to gain that exposure to kids who then could give that exposure to. And I know from experience at work, we've had 2 positive cases and they did not have temperatures. I had somebody say, well, we're taking temperatures. Temperature doesn't make any difference. They didn't have temperatures, they came into work and they were positive. Fortunately, we all wear masks and gloves and take precautions, but and nobody else got it from them. But that's another threat, is that temperatures don't always tell the fact that you're going to be positive, especially on the asymptomatic folks.
I've been asking people their specific symptoms so that I can kind of document that, because I kind of want to know what they have. Very few have had the temperature.
Right.
It's been other things, mostly headaches and nasal congestion. They thought it was a sinus infection. Some of them came, they were technically symptomatic, wound up positive, but the temperatures alone, like you said, is a total unreliable indicator of the illness. We can't just check temps for all 2,000 kids and go by that. Because I've had to take every person's situation case by case, because it's affected. We'll go over these new guidelines, you know, a lot of them. And on that second sheet, since we're on that about the indicator of the fever, I did go ahead and print that out for you just to see the cold versus flu versus coronavirus. Because we're getting ready to come into flu season, and as a healthcare professional and my nurses, I mean, even though I'm a nurse practitioner, you can't determine, you know, based on these symptoms, which one you have, really. I mean, yeah, we can do a flu test and rule that out, but then you automatically have to go get tested for corona. So you can see right there that all those symptoms are very close knit, and I mean, we'll have to send them out.
Do you have enough, are you prepared, and do you have enough tests so that if somebody does feel like they've got the flu, that we can give them a test and rule out, I mean, if they got the flu, maybe rule out something different, so that we don't have to say, well, this is common, we think it might be so? Is that possible?
I can request more. We do have some in stock. You know, I fight that every year, trying to have those test kits available. All I can do is try to get more, you know, spread that out through our telehealth. But,
Because that's going to put you at a real crossroads in the flu season, when you've got a lot of flu started, and then all of a sudden somebody's got flu, and they're in a classroom, and we're quarantining everybody because somebody had the flu. And we don't have quick tests, so, you know, it takes a while to get these tests back. That's gonna be a real problem, do you think?
I mean, usually I get them through the EMD, the company, so that the school system doesn't purchase those, because then they bill. You know, if we want to incur some of that cost to buy those kits, I mean, we're allowed to do that.
What
But,
does the board think? Because that's gonna be a potential problem.
I mean, usually I fight every year to get these, you know, usually in flu season, I don't get them till probably a month or two into them. But,
So your rationale is if they've got symptoms, do a flu test. If they test positive for flu, then we can rule out COVID.
I
no,
don't
it
know that
doesn't
you can
rule
rule
it
it
out.
out, but you might be able, would you be able then, if somebody tests positive for the flu, would you still have to quarantine everybody?
No, the guidelines they want us to do is if they present with these symptoms to me through telehealth, then we'll test for the flu, if it's flu season. And if it's positive, they still have to go, or negative, they still have to go get tested for corona, because that's in the CDC guidelines. It's the same if they have strep, because sore throat is also a symptom of the coronavirus, so we can also have strep screens, and we have those too. So I can test for that to see if that's positive or negative, and they still have to go get tested. But it does help us narrow it down, because if they were positive for strep or flu and they were negative for COVID, I can treat them with antibiotics, Tamiflu, whatever, and get them back. So it does help somewhat if they test negative. But
How long do you say it's taking to get the coronavirus test back now? If you
they've
test?
got some rapid tests, but some of those have not been real reliable on some of them, and so I've asked a couple of people to go get retested. It's coming back in about a day and a half.
Okay.
That fast?
About, at the health department, I've been on the phone with Eden, and they go get tested, they get a patient portal, and if it's not on there by the next day, she said they could call after 2 o'clock, and sometimes it comes to them, and they can get the results.
That's a lot better than it has been.
And some could be a little bit longer, but most of them being right there about a day or half or 2 days max, so.
Even with a negative test, though, we had to quarantine them because they showed symptoms.
That's when we need to go to this first sheet.
This is where it gets very, very tricky.
This is the fun part.
Yeah.
Oh, boy.
That's why I said I have to take each person.
That's
That's why they
just
call
right.
me at 6 o'clock in the morning, because their situation's different. So, and then the critical infrastructure will also play a piece into this as well. But currently, right now, if they have symptoms, what we do, put them in quarantine till they get tested, okay? Depending what they tell me, if they test negative, if they've been around someone that's positive and they're having symptoms and they test negative, I'm still probably going to quarantine them, because they told us, the CDC, to treat that like a probable case, because they were exposed to a positive. Now, if they told me that was a secondary contact, they went to their friend's house, that parent's friend was positive, they're kind of a secondary contact, but they develop symptoms. If they have a temperature or a cough or something for a couple of days, they tested negative, and they're feeling better, I'll probably let them come back. And now, the critical infrastructure, well, I'll wait and discuss that when we get to it, but the only thing now is that if you have a household contact, it puts every family member in that home out basically 24 days, except the individual that's positive. That's where we're gonna get into a mess, because I already have a teacher in this 24-day quarantine. And it could be longer if another one of her family members become positive and she doesn't, because then it increases her time even further. Because you have to add on those days to the last symptomatic person. So, in the 14-day quarantine, depending on when you become symptomatic, a person could be out, depending on how many's in your family. And I got 5 in my family, so I could be out 40 days if I continue not to catch it myself, and each one.
Now, can this teacher still do the virtual training, the virtual teaching?
She can still do the virtual training on there.
But she
And,
can't touch any paperwork and send it to anybody of it?
She's quarantined to her house. I mean, she can't come to the school and
Okay.
do whatever. You can't come make coffee or.
Can the teachers still do the virtual from their home?
I
Of
think.
course, if they're sick with corona and they
They're not
get
gonna
really
feel like
sick,
it.
they're not gonna
They're
feel
not
like
gonna want
doing
to.
it.
Right.
Yeah.
And, we've been able to, save some time with the teacher doing that, and some of the assistants, but it's when our maintenance department and our
Our
bus drivers and our
custodians.
food service staff get affected with that, they can't really do that from home. So that's, where we're.
Let's say that a school bus driver, let's say we went back to school and the school bus driver tests positive, then everybody on that bus that he's taken to school that day would have to be quarantined. And what about, do you have enough extra school bus drivers that if you lose a school bus driver, that you're gonna have somebody to, well, I don't know if all the kids are quarantined, you may not need that bus, but would you, let's just assume that you have a school bus driver who's out. Don't worry about the bus for kids right now, but the school bus driver who's out. Do you have substitute bus drivers to take their places?
I do have a few, which would be basically the maintenance and
Maintenance
mechanics.
crew, yeah.
That would be who the fill-in for substitutes are.
Okay. And what about substitute teachers? Do you have enough substitute teachers if we were to go to school and somebody got sick?
That will be the issue, not knowing who would want to come in to fill in. If we're based on the 24-hour quarantine now, if they're in isolation, on the 20th day, we have to have a certified sub in there. That's state law. So that's another issue on top of finding a normal sub. On the 20th day, we have to have a certified sub, which means a certified teacher has to be in there.
And we don't really, if we have like one nurse sub. So if the nurse gets it, I don't know what we're gonna do, because they're the ones that are checking them out and put them wherever.
Mr. Chairman.
You're a nurse?
What if I get sick?
Mr. Chairman,
Mhm.
instead of going through all these scenarios,
Mhm.
why don't we just close the schools down until the last of September and see what the figures are at the end of September?
Well, I mean, that's what we're gonna decide at the end of the discussion, but I wouldn't be ready to vote for anything until I know all the facts.
Uh,
Anybody else?
Well, it seems like, they presented the facts to us here.
Well, and it's not only for us, but this is being televised, and there's a lot of people who've been, I'm sure, contacting all of us that are probably watching and want to know more of the facts, so. I don't disagree with you, but I think we need all the facts first.
If you're gonna have a bus driver that comes down with it, then you're gonna have all those kids that's on the bus
Mhm.
gonna be quarantined. So
Well-
it makes sense just to close the school down.
Well, that's the purpose of our discussion, is to try to decide what to do with all the facts. What else you got, Wendy?
Well, basically, just to answer your questions, as far as I did put one more sheet on there for you all, just because I've had some calls on concerned parents and teachers. I've had some, wanna go to school, some don't, but it's not that we are just, but that we don't wanna go, it's, we have, just like you all said, you have great grandparents and them calling you. We have a lot of our students that are being raised by their grandparents. The kid possibly will recover, but what they're taking home to somebody that has multiple illnesses is not going to possibly. And then you're gonna have outrageous medical bills where they're in the hospital. I mean, it's just anything, there's just a lot of considerations to take into factor.
It's a very big danger. I've had the personal experience.
And I did put the sheet on there for you all. It's called that multi-system inflammatory disease that children can get. And I'm not gonna say kids are gonna get that, because I don't know, but that is a big relationship to the COVID that kids can get, and it, can be very dangerous. And
It is
I
concerning.
don't know who will get it.
Do you know what percentage of kids get that's had the COVID-19?
I don't. I think they're seeing it a lot more in some kids, but
I think it's too early for them to make
yeah,
any.
if they're doing more research on it, but my thing is more them taking it home to their families. And then they're gonna be in a 24-day quarantine, and those people are out of work again anyway, so for 24 days if it's a household contact. And I know everyone's frustrated on the virtual side too, because I'm a parent and I'm doing it too. I'm up till midnight with my kid doing it, because it is very difficult, I will say, around 4th grade down, to navigate some of that stuff. But we're all trying to work together. I don't know if maybe one solution is maybe on the lower grades to have handwritten packets. But I'm right there with them, so I understand their frustration with the virtual, because I have 3 kids in it also. But I'm having to help my littlest one the most, because she does not know how to navigate that keyboard on that stuff. She's never had to do it, because iPads don't have that kind of stuff. So I sympathize with everyone listening, and I've had the calls too about the virtual learning. But I don't really know what else we can do if we're gonna have to, I don't wanna go back and forth of opening, closing, because we've got so many out.
Okay. Could you talk about the virtual portion of it and how this is going with your staff? Tell us where we're at right now for these 2 weeks.
I'll be happy to. Of course, with anything new, and the virtual was, a new platform for our teachers. First few days was hard. I do think the younger kids have a harder time at it than the older kids. I do think, and the principals are here, they can attest to it, they probably received a whole lot more calls than we did. We didn't really receive a lot. With anything new, there comes struggles. Even with technology, there's always struggles and issues. And, the virtual learning environment has been that way because it is new to our families. And I do sympathize with our grandparents and our great-grandparents and even our parents who just have to work all day and then come home at night and have to sit there and help their students, especially the younger ones. I do think the issues we had on Monday seem to get a little bit better by Friday. Anything new, it does come with challenges, but I do feel like that it has slowly gotten a little better. But again, the principals are here. They can speak more on that if that would be okay for them to speak. Because they do deal with these challenges every day from the teachers and from parents calling. So, and they do have students in their buildings using their computer labs and, having assistance if they need it.
Could you talk just a minute about computer labs? Because that's been a lot of the questions I've had, and parents didn't know that we were, or totally understand about the computer labs. Can you just clarify that for anybody listening?
Yes, for those that, do not have devices and need, just additional support with technology or need a device itself, all the schools have opened up their computer labs. They've scheduled times. The parents just have to call the schools to schedule a time, because depending on which school it is, some schools have more computer labs than others. So they've scheduled times to come in. I know I've heard at the middle school they have 2 or 3 kids that come in every day because they don't have devices at home. So they've scheduled that time and they're coming in every day to use the computers. So, and that's open at all the schools and has been. So, if you don't have access to a device, please call your school and they can set you up a time to come use their labs.
Well, when you do that, is there somebody there to help them?
Yes, there's been teachers going in,
Okay.
correct?
Okay,
We have the labs covered with
okay.
Do you
Real
have
quick.
any extra laptops.
Devices, now that would be at each school. I think some of them have maybe a few extra. The devices we have ordered with our CARES money they're not here yet. But the schools still have some devices.
The reason I ask you that, the library there in the old Shady School, it has internet and they can accommodate about 12, I think.
Oh, okay.
Well, that's good.
That's very good.
So if you have any extra, we'd like to take them over there and let the kids.
The kids would have to come sign them out because we have a form that
Now,
the
he's
parent.
talking about going to the
to the-
computer lab.
Yeah.
Yeah.
Going to Shady School is what
Yeah.
Gary's
You have the
talking about.
computers there or no?
I think he's
He
saying he
have
needs
the
the
lines.
computers.
He needs the
Gotcha.
computers.
Yeah.
So if we can make sure that they get those, even if it's a little later to where we accommodate.
Okay.
That's a good point. And we have, of course, the First Christian
Yes.
Church here in Mountain City, and they've been having quite a few folks go to there.
Well, and Neil Browder with Mark III, they donated several. I don't think they're here yet, but that will get to be
Yeah,
something.
somebody was supposed to be here tonight to
could-
donate some.
Who did?
Neil Browder with
Mr.
Mark
Browder
III
from over there,
from
across
Shady.
from Fire
He's
Hall.
actually, they live in Shady, so.
They were gonna come tonight to present that to us.
At the high school, we've been able to give each family that's requested a device, and extras for some of those that's had 2 or 3 in the household. If they've asked for them, we've been able to grant their request. So we're in good shape as far as people who have asked.
What about Rome Creek?
Since, I wrote down some facts for my school, since August the 18th, we've had 31 employees, kids in our building daily. 8 of them were from the middle school and high school. 24 students have daily appointments in our computer labs. We're running 2 computer labs. There's 25 computers in each lab. We can seat 12 by social distancing in each lab. 10 more signed up today, so we're running that lab from 8:30 to 3:30 in hour increments, and those spaces are filling up quickly. We have a minimum of 2 assistants in those labs to assist the students, and then the teachers will go in, the special education teachers will go in and help the students as they come in. We let them know what students have signed up to go. We've had 66 employees in our building every day, so we're well over 90 people in our building right at it every day. Not 190, I'm sorry, about 120. I think Joey said she checked 118 temperatures today. As of August 17th, 82 of the kids that that said they wanted to go virtual, they're calling now and they don't want to do virtual anymore. We're down to 62 from 82. So there's about 20 that have decided I can't do this. And we've loaned out every device I have, 105 devices. We've loaned them out, and I have a waiting list.
Ed, how many do we have going virtual school?
Total 355.
So we have 355 of our students who've chosen to stay virtual and not come to school.
Yes, sir.
Of those, about 115 are high school students, I believe.
Okay.
I can break them down by school if you want me to. Doe has 32, Laurel 15, Mountain City has 61, Rome Creek has 82, the middle school has 50, and the high school has 115.
I think it's a lot easier for high school students than it would be for, like you say, the little kids. What about special ed? How's that virtual going with special ed, Paula?
Well, there's different levels of special ed. For some, it's working out okay with the accommodations, but with our children who have the more significant disabilities, it's difficult. But now our teachers have provided some hands-on materials, and like some of the principals have said, some of those children come in for computer time, and the special ed teacher and or a special ed assistant can provide services. And
So we're trying to provide, make sure that we're providing for the special ed kids.
yes, and we've ordered some special materials that have just come in this week too, that we can give to those students because they don't necessarily have the ability to work on Chromebooks or laptops or things like that.
One of the other, and like I say, I'm not trying to take the whole time up, anybody jump in, but one of the other things that I've heard over the last several days is marking absent. Children, parents are concerned because their children are getting on and doing the work and then they see an absent score.
Right.
Can you explain that?
Yes, I will. You know, again, the state is requiring us to code every student as D, which is for virtual learning. That is a state requirement. But our student management system is not picking up that D. They're making that an unexcused absence. And we did not realize that till all of the emails went out in the progress report on Friday afternoon, Saturday. I get mine Saturday morning. I think some parents get theirs on Friday night. But Edna they have called our Skyward, that's our student management system, and they are working on getting that taken out. So, you know, again, I know parents were upset with that. You know, the first day I got an email saying, you know, my child was absent, and I'm like, no, he wasn't. He was on the computer all day. But it's just, again, it's a learning.
That was your child.
That was my child. Yeah, yeah. It's a learning progress for us. You know, we are finding things that we've never had to deal with. That as soon as we find them, we are fixing them. We're fixing the issues. Edna was on top of that the first day that it happened. So, that is. I don't want parents to, and I know as a parent when you see my child was absent, but you know they've been sitting there all day doing their work. That is very frustrating. I understand that, but you know when we found out that was going on, Edna got that fixed. So. And do you have anything else you want to?
I've just tried to explain to parents that when they see that distance learning, it does, because a lot of them are seeing that and thinking they're absent because they see distance learning. And I've just tried to explain to them that this program sees that they are not sitting in the classroom, in a regular classroom learning, but rather they are learning through distance learning. If we have a child that goes on a field trip, we have to code that child as an F. Even though that child is in school, he's coded differently. A child that is at alternative school, we can't code that child normally. We have to code that child, he was in school, but we have to code him as I think it's an A for alternative school. It does show up on it's called an absence occurrence report, but it doesn't mean they are absent. It just shows they're here, but they're not sitting in a regular classroom. And I've tried to explain that to parents.
And don't think they got an F for the day.
Right.
That just means field trip.
Right, right. So I've tried to explain that's what the D means. We have, Miss Osborne has put a stop to all of the emails that are going out to parents about their students are absent, and she has put a stop to all of the call-outs that Skyward does as well. So if parents are still having that problem, they need to either call me, Miss Osborne, or the schools.
Call Edna Miller.
Or the schools.
What's your personal number, Edna?
867-5309.
What about I've had a number of them talk about, and I think Wendy alluded to it a little bit, about the amount of work that they're doing and trying to crunch it in periods. And in addition to that amount of work would be, are we trying to realize the difficulties on these first few weeks with virtual versus the amount of work versus parents who work all day? Is there something we're understanding? I think there's a number of people who contacted me that are concerned because it's kind of like cut and dry, it's my kid's gonna fail.
Right. And I know that those, concerns are out there, and we're not here to fail any student. I can tell you that our teachers are not here to do that. I do think you have a variety of teachers. Some give more work than others, but that would happen if they were sitting in the classroom. That's just the nature of being a teacher. I don't want teachers to feel like, I know the first few days they felt like they had to get all those assignments done that specific day. and, you know, some of our teachers were maybe conveying that mistakenly, but, you know, not aware that the students were feeling so much stress. And, you know, those parents that called, we did get those addressed. You know, we got to give our students some time to get their assignments done, because, you know, they're sitting at home doing classwork for 5 teachers, in essence, if they're at the high school. So, you know, giving that grace period a little bit longer due dates to help our families that do work during the day and they have to go home and help their child at night. You know, if you're still having issues with that with teachers, you need to contact either the principal, you can contact us. But I don't think that we're still having that problem from what I understand. Sherry?
One parent allowed me to understand it in their perspective better last week when she said, I have 3 children, 1 device, we're not having a problem taking turns, but I'm having to help all 3 of them. And what I realized was, if those children were in the building, they would have 3 teachers, 1 for each of them. But mom, grandma, dad, aunt, uncle, guardian is 1 teacher for 3 kids, 3 different grade levels, 3 different platforms. I don't want to say our single children are not struggling, because some of them are, but the ones that are struggling the hardest, I think, are the ones that have multiple children in different grade levels.
And I agree with
Because,
that.
you know, and we're only really using 2 platforms in the district,
Right.
Google Classroom and Canvas. But it's still hard to navigate when you have more than 1 child in the home, you know, or you work from 7 to 7, you're on that shift, and you can't help your child till then.
Well, you said we're only using 2 platforms. I'm hearing from folks that say there's so many. I don't know whether if it's the teacher saying go to this YouTube video or what. They've got to come out of a certain platform and go into something else to see what they need to see.
Yeah.
Honestly, they're missing the instruction from the teacher. If they were in the building, they wouldn't necessarily have that YouTube video to explain how to do that lesson, in addition or multiplying fractions. So the teachers, at least in my building, I can't speak for anybody else except my teachers, they are providing links to Think Central, which is for our Go Math, and YouTube videos or Khan Academy to help explain, or they're videoing themselves, you know, doing the actual lesson. And some parents want that, and some parents don't want that. But the bottom line is they don't understand how to do the work, and that's understandable. I probably couldn't do it either. I've tried 6th grade math. It's very difficult.
So you're giving them extra links so that they can
Have
have
instruction.
extra help.
And I do think what Kevin and Sherry said is, you know, they're going to 1 platform, but then they're having to click on this to take you to Think Central, which they're considering another platform.
Yeah.
So it's not that we
Yeah.
have all these different platforms, it's just it takes you to a different place to assess or to watch a video or
Well, I
to.
have-
And it's actually different applications.
Yes.
Well, I had a-
Clever is another one we use.
Clever, Canvas, I mean, there's
Had a-
all kinds out there that our teachers
I had a
utilize.
gentleman send me, I think it's a gentleman, send me a statement and then a video of his daughter
Yes.
absolutely breaking down. Because when she moved out of what she had done and went to this platform, she lost everything she had. All the work she had done was gone.
And I'm
She
sure it
had to
broke her
redo it.
heart.
And that's not the first time. So we need to help something, whether we send home packets that kindergarten, 1st and 2nd grade can do by hand. I know what the state says, but my job right here is to take care of my students, and I can't do that in this situation.
I tell you what.
So we need to fix it somehow
Yeah.
for the parents and for the students.
Right.
There was one teacher actually mentioned this to me, and see if it'd be possible. The parents that are struggling, let them schedule like an appointment and let them bring their child in for that hour and help them with these platforms and show them.
And I mean, and they're,
And I
and we're
think
doing
that's
that.
helping with,
But yeah, you
some
got-
are doing that.
We are already doing, I don't know, again, I can't speak for anybody else, but Rome Creek, we are having people in there all day, every day. It's a revolving door. They're wearing masks. They're meeting the teachers, and Mr. Moorfield, Buddy Moorfield is our tech person. He's right there in that foyer helping these parents get everything set up. Our teachers are in there helping everybody get set up. We're calling Rob daily, Norm daily, but we are helping them. If they're hollering at us, we're saying, come here, you know, and we're gonna help you get this stuff set up. I will tell you though, they get back home and their internet provider is spotty. Their internet service is spotty. It might be okay for them to get on their Gmail account, but then they can't access the video
Right.
because
of their internet service. That's beyond our control.
They may not have,
Now, there was
strict
just,
stream.
yeah, there was just, what is it, $21 million approved for infrastructure, and that would have to go through the county.
I guess we could go through
Mike
the.
Taylor would have to look at that, because, like you say, there's areas that just don't have good service.
I think that's a good point that Mr. Long's making, is for all the principals to, and that's one of the notes that I had from some parents, is to be able to come in and get some training, or grandparents on training on the virtual, and ask questions about it. So are all the schools, I know I don't see the Laurel or Mountain City,
Ms.
or
Triplett was
Doe.
supposed to be here, something must have.
But how about, well, again, I think the middle school and high school, you're a little bit more adept at computers, aren't they?
They are, but anybody that's called, like, I know Friday I had a parent call and say, listen, my student's having problems on this, getting logged into a certain class, and I said, can you come up here? And they said, yeah, and I said, well, come on. They said, I'll be there in 10 minutes. So they came on up, and we had the classroom teacher that they had questions about there, plus the guidance counselor, who's also our tech person, to help. The problem we run into, the parents that are working during the day and just can't drive up to the school, obviously. But
I was saying that runs into the infrastructure when everybody gets home from work, everybody's on the computer.
that's right.
Yeah.
Which slows everything down.
Well, I mean, we may have to have a night or two, kind of like you do when you have parent-teacher conferences, where you have an evening for parents who work, and ask parents who don't work to come during the day, and parents who do at night. And I think that would really help. I think that,
Some of the labs are, I know at elementary level, some of our labs are open at night, so we are trying to accommodate that.
We've offered to open up the lab at the middle school early in the morning. We've not had any takers on that yet. And we've offered to stay open until at least 7 or later if we need to, and we haven't had any takers on that yet. But we have had some that are coming. We've broken it up in the morning time and an afternoon time, and we have like 4 kids coming every day. And the teacher is able to come down and help those kids, and we've been able, we feel real good about our social distancing. And we could handle a lot more at the middle school if, the need is there. We can handle it, but now I have to be careful. I don't know what all our teachers are already handling in the classroom. I know they're working really hard, and I will say that I'm seeing a lot of teaching going on. The Zoom calls, the Google Meets, they're impressive, and I've asked the teachers to let me know, to invite me, and I can just hop on and say hi to the kids and talk to the kids. So, it's not all bad. And 2, parent engagement's out the roof. We're talking to parents that we've never, had the opportunity to talk to before, so.
Well, I do know, I've heard some comments from teachers, particularly, that they're not hearing from parents. And then I've heard from parents that saying that they didn't know that they could do this. I didn't know I could do it. And I don't know how to tell them any different. How are we letting these folks know what they can do, like the labs are open, and then
We've done a call out, and we put it on Facebook, and we've got it on our website. And, when we passed out books, we saw about 300 of our parents that night picking up the textbooks. So, we tell them the lab's open, whatever you need, we're there to help. know, if there's a need out there, just let us know.
Well, the other, when I said it, I said, well, they put it on Facebook, but I don't have internet. I can't get internet. So how do we let those folks know?
The call out goes to every.
I mean, do you know on the other end if that's going to where it's supposed to be going to?
Now, I know when I do a call out, I get a report back that says,
Is there a
this meeting
report?
did not receive it.
Okay,
Yeah.
I didn't know that.
Yeah.
Going on. Okay.
Yeah.
So they should be, I mean,
Now, if they have changed phones, that sometimes is an issue, and they don't either go into Skyward and fix their phone, or call the school and tell the secretary, I've changed phones, here's my new number, then in that instance, they wouldn't, but it's because they've not let us know that their number has changed.
Well, and it would,
For the longest time,
Yeah.
I didn't have, sorry, I didn't hear you.
That's okay.
For the longest time, I didn't have voicemail enabled on my phone. And if you miss a call out, you just miss a call out. Now, you'll show a missed call from 2640 or 2600 or whatever number it is. But if people can make sure that their voicemail is enabled on their phone, those call outs will go to voicemail.
And if they make sure their email's updated, it'll email the voice recording. It'll go into Skyward.
We-
Didn't get that.
Yeah.
The parents that we've not heard from at Rome Creek, the teachers are calling. They're calling, like, everybody on that emergency list. And our counselor, Ms. Litford, is helping make those phone calls too. And I think all the counselors were, instructed to help with that. And so that's getting that information out, along with the call outs and, emails and social media.
And I think, too, the SROs, if they're
We
needing
have sent out
materials
SRO
or things like
officers, too.
that,
Yes.
then the SROs are taking those to the homes as needed. They've been very helpful.
And I will say that our schools have been really diligent. If we have a student that a teacher has not been in contact with and they can't find them, the SROs they've been doing home visits to try to find these kids that no one has been in touch with.
what about if you did come back blended in any respect? How would you do that? How would you do virtual school and in school?
We would continue to teach our students.
I think that's what I hear from teachers the most is, I'm putting all this effort into virtual school, and if I'm going to be standing up in the classroom, how am I going to do both?
Yeah, because they'll be doing double duty, because they will not only be teaching those kids that are sitting in their room that day, they also have to teach those that are in the virtual environment. Let's just say the board said, let's go back 50%, whoever they have in their classroom that day, if they have 50% of their students, well, 50% are still at home online learning virtual. So they're going to have to navigate both worlds.
How do you do that?
That will be tough.
I'm sorry.
But now I will say Dr. Long has come up with a plan at Rome Creek and it's a very good proposal that would work
Because most
very
of the
well.
teachers I hear from Rome Creek are wanting to go back to school.
Yes, they do.
Kindergarten through second grade, the proposal for hybrid learning would be that teachers will teach their in-person students, whether it's 25% or 50%, from 7:45 to 2 p.m. every day. And then from 2 to 3, I would make a schedule where they are on a rotation for specialty classes, recess, or in the computer lab with assistants. And then the teachers would have from 2 to 3:30 every day to do their calls, their lessons, their recordings, and answering emails, the things that they're doing now when they're not answering calls or talking to students. 3rd through 6th grade, the proposal would be that the grade level teams, which I have 3 in my building for each grade level, that they would rotate students. Even though that the biggest number I have, if we went 50%, would be 22, 25 kids. And so instead of having 2 kids in one homeroom, 3 in another, and 5 in another, as an example, 2 of the teachers would split the 50% of kids, and that 3rd teacher will have an hour-and-a-half block of time to do the calls, the emails, their lessons and recordings, while the others get their ELA or their science and social studies. And then they'll rotate. So each teacher will get an hour-and-a-half block. So I've got it worked out to where every teacher in my building would get a minimum of an hour and a half every day of planning and doing their lessons and their recordings. So they would not have to take it home if they didn't want to.
Where did you say in there though about how they're gonna do the virtual?
That's the hour and a half.
That's their hour and a half, where they would reach out to their virtual kids and answer the calls from the parents.
Because most
Well,
teachers
they're
are
doing
there.
it now, and some of them's, I mean, I don't have kids in the classroom, and some of them's doing this till 9 o'clock at night. Hour and a half ain't gonna cut it.
It's a start. And I have talked to all of my teachers today, and they are all in agreement. They want their kids back. First grade through sixth grade want their kids back, at least at 25%, so they can get, with them and work with them and help them, because they're struggling. They really are struggling, especially these little ones.
Well, how would, let's say, middle school's got a teacher's got 100 kids, how could they handle it? If we did
I will say
split?
that has been the biggest concern of my teachers, is how they would do that. I'm not so sure that an hour and a half would even make a dent in what they're doing virtually now. And to have to do it over, and we've tossed ideas back and forth, because we know eventually that's coming, and that we will do it, and hopefully have a good plan by then. But, right now we don't have virtual smoothed out, and to start blended, I think is just gonna set us back.
You think the high school would be in the same boat? Okay.
Yeah, you've got some teachers that have over 100 students daily that they could see.
And it may not seem fair, but if there's any way we could consider it, at least K-6, getting some in-person time, because I do agree that middle school and high school kids are navigating the technology a lot better.
More computer savvy and.
They are.
Than the younger kids are. It's very hard to teach phonics virtually. How to say the letter sound.
Teach kids to read and write.
Right.
Yes.
That's hard to do if they're not
Very
sitting in
hard.
the classroom. It is very hard.
What is if you do go back to school, somewhere I understand that the legislature has passed it that there will have to be masks and there will have to be consequences to those who do not wear them.
Mm-hmm.
What is the latest on that? Do you, either one of you?
Yes, and that's with the critical infrastructure.
Oh, I'm sorry.
But do you want me to go ahead and speak to that?
Is that okay? Sure.
One of the things with, if we are critical infrastructure, which is item number 4, but I'll just go ahead and touch briefly on that. This is allowing this is not talking about those employees that have tested positive. This is the employees who are maybe a contact case or in isolation, that they could come back. But one of those things, if we are critical infrastructure, then when we do have students come back, students in grades 3 through 12, and this is the law, 3 through 12 are required to wear a mask. We have to put in our plan, if someone does not wear a mask, then we have to state in our plan, what's the punishment. For example, this was on the call that we listened to the other day. First time might be a warning. Second time it might be you have to go to ISS. Third time, and I'm just stating what they said in the call. An example, third time suspension, because they're not wearing a mask, because that is part of it. They have to wear a mask if they're in grades 3 through 12. Now, not when they're eating, of course, but, when they're in the classroom, when they're changing classes in the hallways, that masks will be required, and we have to have some kind of policy of what will happen if a child is not.
I thought that was only if they had some type of exposure.
No, not with critical infrastructure, it's required.
I'll say we had a student today who came in with his grandmother to do some work, and he refused to wear a mask. He would not.
And we will have those issues.
Well, there's, as much as I hate it, there's childhood horrors that some of these kids have probably faced, that they just don't want nothing on their mouth.
Mm-hmm.
I can understand that.
But that's gonna be the problem if we open up and we've got coronavirus in the community, is that if we're not, then that's easily passed. So, okay. So what is the, if we stay on number 4 for just a minute, approve adopting the provisions of the critical infrastructure, explain that out to us, so that,
Okay.
because that's an item to vote on.
I'll get to my notes. With that, that is for our employees, that's for our staff members. Again, anyone that is positive for COVID, this does not apply to them. They cannot work. They can't. They can work from home. Anyone who lives with a positive case in the household, they cannot work. They have to work from home. We're only talking about those employees who, it only impacts those work contacts. They don't live in a household with someone, but they were in contact with someone maybe that got it at a birthday party or something. So those people can work. All of our staff are required to wear masks, which we've already put that in our plan that they are. The biggest thing is all students grades 3 through 12 are required to wear a mask. We have to put that in our plan. Students either have to eat lunch in the classroom, or we have to have smaller lunches where they can space out at least 3 to 6 feet apart. Teachers have to, if they are in isolation, then they can't eat with anyone. They have to eat by themselves, which that's sort of like in the plan right now. But that's the main things with the critical infrastructure. That way, for example, what we had happen at the maintenance department a few weeks ago, where the health department said schools couldn't be critical infrastructure, we had to send the whole maintenance department home. If we could have done the critical infrastructure, they wouldn't have had to all go home.
So-
I have one piece of that.
Yes.
The only other thing it changes for staff as well is it does require them to be tested more often. If they are exposed, they have to get tested either on or by day 4. And then if they come back negative, they have to go retest in 3 days.
Okay, we've heard, well, I've heard, I guess you hear everything, but a lot of places are testing too early. So where does that fall? If you test on day 4 and the symptoms don't show up till day 10, what's the purpose of that? I know we're just doing what we're told.
Well, up to the 4, and our guidelines are that you don't go right out and test if you had exposure, because you are too early, and you're generally going to get a negative test. But after about day 4 to 5, if you test, you're probably going to see more of that result. But you got a good point if it's up to a later point. But it does give you some guidance, I guess. I know that I just know from personal experience the masks and the distancing do help, because I've had 2 positive employees and they came to work and are because we are considered critical employees. The rule is that if you've had exposure, you have to wear a mask and you have to wear gloves. And if you're eating, you have to eat alone, not with anybody around you. And it's protect everybody else, because they've come in positive. The rest, because we wear masks and gloves, haven't got it. So, my concern would be with somebody who comes to the school and is not going to wear a mask, is that they don't come in, because we're jeopardizing our whole system if we do. One person can start spreading that. And I think that's the danger. And, if people choose that, then they need to go to virtual school. So on this, if it pleases the board, then can we pick up 4 so that we can at least deal with one of these items? 4 is approve adopting the provisions of critical infrastructure. And this is by the Department of Health, correct? And by the legislature?
By the legislature. And we just have to, even though you all did approve it in July, if you remember when we brought it to you, then the Department of Health took that option away from the school systems, but now they have brought it back to the school systems to make our employees critical infrastructure employees. We just have to have it in the minutes saying that, we do approve this, and then we have to submit a plan to them with just the statements that I said. Masks required 3 through 12. All our employees will wear masks, just hitting the highlights that we stated.
Okay, do we have a motion on item number 4?
Yeah, I'll make a motion, we approve number 4.
Okay, Mr. Payne's made a motion. Have a second?
Second.
Mr. Mr. Long has seconded it. Any other discussion on that? If you will, call the roll, please.
Mr. Carlton?
Yes.
Mr. Long?
Yes.
Ms. Reese?
Yes.
Mr. Payne?
Yes.
Mr. Matheson?
Yes.
Okay, so, really before these other two, I would assume that we go back to number 1. And this is a discussion and approval of our, where we're at right now. So what is the pleasure of the board? Does anybody want to make a motion to some effect?
It's tough, but from what I'm hearing, it looks like we need to probably stay virtual for a couple of weeks, unless we do what Mr. Matheson says here.
Well, I think what we need to do is let the doctor right there give us some good advice of what to do.
I don't know, we were gonna take it 2 weeks at a time, but that's up to you. I mean, they've changed this information on us every week at these,
Sometimes every day.
Yeah.
and we have another conference call tomorrow at 9 o'clock. So I feel like we don't need to go back all the way right now. It's at least 2 weeks or till the end of September, just because we came in for 1 week and 50 staff being affected. I don't know what it would do with having students in there deal with it too.
I think that is a point that we need to make, is if there were 1 week back and 50 staff, we'd have been shut back down.
Yeah. And with a hybrid right now, like, it might work for the elementary level, but the high school, middle school can't. I can't see how they can do it.
And I think that it is hard
And-
on the virtual, on the little ones, but they're also the ones who are gonna be hardest probably to keep this on too, and
Now,
But I'll go along with Mrs. Long. I mean, those small kids really need that personal, in-house instruction.
all kids need it, but, you
Well,
know,
I
they
do- I know
need
that,
it,
but-
they need it more than others. I
But
agree.
that lower grades down there, they need that. She has a good plan, I enjoy it. But I think it really depends on what decision you think we need to make as far as this virus goes.
well, I think not go back just yet, because like I said, we had 50 staff together in 1 week. I don't know what it would be with the kids. But,
Well, I
and
think,
we shut it down with sports too, so.
I
couple
think you've
things.
given us the best, the best information that you have available to us, and, I don't want to put all this on your shoulders, because, the bottom line is, I agree with Mr. Masson. I wanted to hear from you as far as all the facts and figures. So we have a motion to postpone reopening school for 2 weeks, stay virtual, and meet again at our regular board meeting and make another determination as far as, are we ready to go back, partial, full, stay virtual?
Oh, well, I've got a question. Is there any way that we can get kindergarten, first and second, something in hand, something that parent, grandparent can give them to do that's not on the computer?
You mean like this, like a packet?
Something, yes.
We're working with families on an individual basis. There's some families that, there's been teachers that's contacted me and they've worked with the families and they're like, they just absolutely cannot do this. And so if those families will reach out to those teachers, we will accommodate them, but we've already been doing that.
So if they're having difficulty, you'll take care of them in whatever
And
way you
They
can.
just need to contact the teacher and that they will work with them. We already have been doing that.
Okay, I'll give you a telephone number.
Okay, good deal. All right, do we have a second on Mr. Payne's motion?
Second.
Okay, we have a second from Mr. Long.
Stay
Now,
virtual. Stay virtual, yeah.
Open for
For 2 weeks.
discussion.
State statement, state to.
That we will continue virtual school for the next 2 weeks
For the
and
next
meet
2
at our
weeks,
regular,
to our meeting.
regular
Right.
meeting and make a new review like however much information we need to feel comfortable to vote.
Good? Second.
All right, so we have a second. Any other discussion on this? You know, I know there's call the roll.
Mr. Carlton?
Yeah, I'm gonna, before I make my vote, I'm gonna say that I know there is a diverse amount of opinions on this. And I've seen all the polls that you've taken, and I don't know that the polls help because they're all over the board. And, you know, if you put these two together, these people don't wanna go, these folks do, it's about even. I know the calls and emails I've gotten from Rome Creek, they wanna go back. I know from one of the other schools, I won't point them out, they're not here tonight, but they don't want to go back, and I know there's a lot of parents who want to go back and parents who say we need to wait just until this is safe. And I truly believe, like I say, I've had this personal experience in my wife's family where near death, and I think that if we go back to school and we start seeing a lot of that, there'll be people regretting if we went back full time. So I'm going to vote for virtual school for 2 weeks.
Mr. Long?
Yes.
Ms. Reese?
Yes.
Mr. Payne?
Yes.
Mr. Matheson?
Yes.
Okay, and I do sympathize with folks, and I'm with the rest of the board, figure out which ways we can help people in the best way we
Yeah.
can. And one thing I'd like to bring up to the board, I had several comments, because I was hard to get a hold of. I don't answer, I will say this out loud, I don't answer our home phone. That's simply there for the computer. But when I started getting a number of calls, I went to the answering machine and there were people on there, and I tried to call everybody back. And my phone number's not listed. And they attempted to call through the school system, and rightfully so. The school system, unless we tell them, is not going to give them my personal information. So I'm basically telling Dr. Simcox's office that if somebody wants to email me or call me on my cell phone, because I don't answer my house phone, I'm good with letting them have that. And the questions were that, you know, we're elected officials, this is a special time, and they want to be able to get a hold of us. So I don't, individually, you might want to let them know.
If you let us know, we're Sharina, when most people call, they ask for Sharina, for you all. Mr. Long is a yes.
Okay, next item is to revisit the calendar options for the 2020-2021 school year. This dealt with the fall break and the day before Thanksgiving. I'll open that up to Mr. Payne. I think you were the one who originally.
One thing is, if we take care of our teachers, we're taking care of our kids. And a lot of our teachers have plans, a lot of parents have plans for that week. So I would like to revisit that and take the fall break back out and the day before Thanksgiving of the calendar. And I think most of the teachers I've talked to would like to do that.
What do you want to replace it with?
We're going to add that at the end of the year. It's that option number 2 that you gave us.
2 that you all got last time. It would be adding 8 days.
Instead of option 1, it'd be option 2. It just extends the year 6 days.
8.
8 days?
So, Dr. Simcox?
Yep.
Well, with option 2, it would keep fall break, so fall break would have been added back in. We did take the fall break away. We took the Wednesday before Thanksgiving away, so that would put that back in. We would still have no Veterans Day, no Martin Luther King Day, and no President's Day, so that would account for 3 days. So then we would, at the end, just be adding on 5 days to the end of the calendar, which would put us at June the 3rd getting out. Remember, we have 18 snow days built into our calendar. Those 13 are stockpile days, so we can back up 5 if we don't use them. So if we were able to back up 5, that would have us ending with 180 days at May the 26th.
Yeah.
If we chose to go, if you all chose to go option 2.
And while we're on this, let me mention this too. I forget who told me this, if it's a parent or a teacher, it's probably one of the teachers. But if we can get this virtual knocked down, would there be a way, like when there's a snow day, instead of just canceling school, we can say, okay, due to the weather, we're going to do virtual school this day?
We could have a virtual day. The thing you got to realize, though, for this year, it's already been voted on for the 13 stockpile days, so that would not change.
I mean, but in the future, because, you know,
In the
the way we're
future,
struggling, we might not get this fixed, but anyway, at least we're trying. But if we can get that down, then maybe we can just have that virtual day. And, you know, we're tacking on, was it 30 minutes every day into school?
30 minutes is our extended time.
So we might be able to go back and start getting out of school a little earlier if we can do that.
Yeah. We would change our,
Would
we
that
change our
be-
school day.
Is that something that maybe our teachers would like?
You know, they vote on that currently. That's part of, you know, policy. They do get to vote on that every year.
Yeah.
You know, right now.
But since if we can do the virtual school for those days we miss, they might. So
they
that's just
might-
something to keep in
They may
mind.
not want to use the stock call days and take the 30 minutes off.
But this year, we will take the 13 days.
We
Yes.
have to.
We do have to. We have
Yeah.
to. Okay, gotcha.
Yeah, that's already been.
Because we've
we
already
can't
got the
change that one.
schedule,
Right.
the extra time for each day. Is
Right,
that
right.
correct?
We can't
Okay.
change that one.
But that's a
Okay.
side note. But anyway, yeah, I guess,
So, Ms. Miller, last time we discussed this, there were some issues with what we'd already decided and what's already been submitted. What are the circumstances if we were to change?
It takes 2 days to go in and change the calendar and to be, I think a lot of people feel like the calendar is just put out there so the public can see this is what we're doing, these are our days off, blah, 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 blah. It's not that simple. We have to put in so many days, we have to put so many holidays, we have to put in so many other holidays. There's just all different kinds of things that you have to put in the calendar. And then that calendar has to be approved by the State Department. We've already changed it one time, and I'm just afraid of what the state is going to say if we come back and say, okay, we've changed our minds again and we want to change it again. It's not a simple process. I understand where people are coming from, but it's not just a simple process and we go in, we change the date, boom, it's back on the website. That's not how it goes.
Can they say no?
They can say no.
They have to approve.
Also, we have to have 20-day reporting periods, and that is based on our calendar as well. So those 20-day reporting periods will have to be redone, reapproved by the State Department again. Then we have to go and we will have to change the grading periods for the report cards. The grading periods and the reporting periods are two different things. So the reporting periods and the grading periods will have to be redone and approved by the State Department. So your calendar's going to have to be reapproved. Your 20-day reporting periods are going to have to be reset and reapproved. And your grading periods are going to have to be set and reapproved by the State Department.
You know, in all the stuff that anybody sent me in the last week, I haven't had anybody said anything about the calendar, including teachers. The parents have not. And one of the issues that I want to bring up in a minute, sports. I mean, that's on our next thing. I've heard a lot about that, but I've not heard one word
I
about it.
think virtual has sort of overshadowed that.
I think
but
so.
Yeah, it has.
Well, and if you remember, one of our concerns was getting started on virtual and then stopping for break.
Yeah.
That- All right, so this is a revisit. This
Yeah.
isn't necessarily, I mean, do we want to make a motion? Do we want to?
Well, I'll go ahead and make the motion that we change the calendar to option 2.
Okay, so Mr. Payne's made a motion. Is there a second on that?
Well, I'll second it, and then I'll say what I need to say in a minute. so.
Okay. Okay, Ms. Reese has seconded. Okay, now open it for discussion.
Well, the reason that I feel like that we do, I feel like that when we first voted on this, even though we did discuss it a lot, that we didn't realize what some of the situations were going to be. Like with the virtual, you know, everybody's stressed to the max, and they're going to be. And I just feel like that everybody is really going to need a break from whatever we're doing. I really do.
Yeah.
And I've had a lot of people that have expressed their concerns about it, that they would asked us if we would reconsider giving them fall break. And at the time, you know, we didn't. I've got a 7-year-old that I'm helping, and I know I'm gonna need a break.
Yeah, I've got a 6-year-old myself, so yeah. I'm living through this too. I'm doing this virtual with my grandson, so. But I just got one. I don't have the 3. Some people have 5, I
Yes,
understand.
I'll
But
see how they
anyway.
do it.
For the teachers, one of the other things that we had talked about for the teachers, they would still be, if a teacher, and this was early on before we ever met, but if a teacher was going on a vacation, would they be able to take their computers with their kids and do virtual teaching
Yes.
and do their kids from wherever?
Yes, if we're still full virtual. you know.
Well, let's help.
But that's gonna
Let's
bring-
hope we're in school by October.
That's gonna bring up another issue, because if you allow the teachers to do that, then you have all these other employees. They're still gonna be sitting here working, and they're gonna be gone, and it's gonna
That's
take
true.
them maybe an hour or something. And I feel like that could be a conflict.
Yeah, well, I don't think they can do it in an hour. You know, if you're at the beach
Well,
and
yeah.
you're gonna have to send your spouse and kids down to the beach, and you get to sit there and do your work for a couple, 3 hours. But, and that's the way I feel. But
Okay.
it's a pleasure to the board. I'll support whatever the board says, and we'll carry on.
Okay.
But that's the way I feel.
Any other discussion? Okay, if you call the roll.
Mr. Carlton,
I'm gonna vote no.
Mr. Long,
No.
Ms. Reese,
Yes.
Mr. Payne,
Yes.
Mr. Matheson,
No.
Okay. All right, so we move on to the next one, and I'm gonna tell you this, and I've already heard it tonight, with a new COVID case on the team. Sports, having sports and not having school, and I've
Yeah.
had some very irate folks talk to me about this, so what does the board think? This item here is gonna be to approve the transfer of undesignated funds, which I think is separate from what we're talking about anyway.
It is.
Because we
It
still
is.
have to keep our teams if we go back full-time. But at some point,
Yeah.
the discussion of that, approve the transfer of undesignated funds in the amount of $30,000 to the general purpose budget to assist for revenue sports. And this isn't just because, I mean, if we decided that we weren't gonna have sports, we'd still need to do something, because in the future, we do need our sports teams.
Yeah.
So,
Let me throw this at you, and I guess Mr. Long's back there. Would this be feasible? Since a lot of people's upset using this tax money where we normally don't, whenever we get back, could we have some kind of reimbursement plan, like when we do get to fill our stadium back up? If we do have to use this, it needs to be reimbursed. Would that be feasible? And while I've got you talking, if you don't mind, I'm getting a lot of people saying, why can we have our sports teams and not have school? If you can address that.
That's not really my decision.
Okay.
Whether we can have sports and not have school, I see that as a separate agenda item from what we're discussing here. But as far as the funding, but I'll answer it, since you asked it, I'll answer it the best way I can.
Okay.
As the supervisor who's over athletics, when I presented this a couple weeks ago, it was my job to make the case for athletics. And so I made that case. I'll restate some things. I don't know if I said these things 2 weeks ago or not. One thing, participation in athletics is not compulsory. Attendance at school is compulsory. Perhaps there are employers who are being very forgiving of their employees who are parents. And maybe they would not be so forgiving if we were back in school, ergo the parents might feel compelled to put their kids in school even though they would prefer not to. But nobody has to participate in sports. No one has to attend sports as a spectator. It is 100% optional. And students who are participating then and their guardians have signed waivers, which we were advised was not an option for general participation and attendance in school. So there is a difference. Do I, as a citizen and a parent, former athlete, graduate of this county myself, get the argument and get the reason that that's a sore spot? I do. I do. I understand that people say we ought to be in school if we're playing ball. I understand that. I'm glad, and I mean this respectfully, and I don't envy the 5 of you. I'm glad that that wasn't my decision. I really am. To your question about the reimbursement of the funds, frankly, that would be difficult to do because they don't operate that much in the black. So what we're talking about is keeping them afloat. And then when they get back to drawing normal sized crowds, they sort of live paycheck to paycheck, so to speak. They exist on what they make. So would they ever get that much ahead to reimburse? Possibly. And I had one coach reach out to me and say, hey, we'd like to consider this a loan. And I told him, well, we'll cross that bridge when we get to it, assuming that the board approves it, which is completely up to you. But it's possible, but I wouldn't want to commit to it. I wouldn't want to commit them to it because I don't see, you know, when we did our stadium capacity on football, if we were to meet that 1,250 capacity, those gates will actually be pretty good. When I say those gates, I'm talking about the money that comes in on that Friday night. Basketball attendance is going to be devastating. When you walk into our gym, it seems like a pretty big place, but the seating capacity in it is rather small compared to other area gymnasiums. And when we social distance in that, that's going to be hit pretty hard. So the question is, I can't answer it. I mean, I guess the answer is I can't really answer it, Mr. Payne. I don't know if they could or not.
The 30,000 is an amount, but that's not necessarily going to be used.
Correct.
It would be used as needed.
You may need $5,000 and that'd be it.
That's correct. As opposed to my other budget, which is for non-revenue sports, which we use all of it.
Right.
This would just be sitting there, you know, if football runs dry and they don't have enough money to get to Claiborne County, we have to help them do so they don't miss their game.
Well,
I hope I answered the question about why sports versus not why sports as best that I can.
I think you did a good
Yeah, I think so.
explanation.
So at the end of the season, if you only use 5,000 of the 30,
Yeah, it just comes.
you put the other 25 back in.
Yes.
Yes, sir.
It doesn't ever come out, really.
Yeah,
does
it doesn't stay in the sports fund. It goes back to, I'll turn it back over to Miss Lidford and she puts it where it goes.
But I mean, will this be an amount that they have, or is this
It
gonna
will.
be if he needs something
It
for
will
500, he'll get 500?
It'll stay in the central
Right.
office budget, so they would have to come and ask for exactly what they needed, and then at the end of the year, whatever is back would roll back into your all's fund balance.
Okay.
And we're gonna be conservative with that, very conservative, right?
Very.
And another question that was presented to me was, let's make sure it's not abused, like optional tournaments, like not go to tournaments, you know what I'm saying?
Florida.
No, it would
Yeah.
not be used for that
Yeah.
whatsoever.
In fact, there's some pretty strict limits on tournaments right now anyway.
I think too,
That's a good
NCAA.
point, but they kind of can't travel far and wide under the current guidelines.
Okay.
Well, and one of the things I feel like is that we're trying to balance things, and I understand the conversations that I've had, but, you know, I think we're still trying to balance things for our kids and trying to have some type of normalcy and some type of a system that we can get back on track with. And unfortunately, you know, we're having to make these decisions, and nobody likes them. I don't know. Okay, so this one needs a motion to approve. Okay, Mr. Long has made a motion. Do we have a second? It's approved the transfer of undesignated funds in the amount of $30,000 to the general purpose budget to assist as needed for revenue. So it's not a $30,000 gift. It's,
Lump sum.
it's we'll set money aside to do what we have to do.
I'll second.
Okay, Ms. Reese, any more discussion?
Is this gonna be used for football and basketball? Is
Yes,
that what
football
we're
and
saying?
basketball is our revenue. Middle school, high school, football and basketball is our revenue sports.
Okay, okay.
All right, any other questions? Call the roll.
Mr. Carlton?
Yes.
Mr. Long?
Yes.
Ms. Reese?
Yes.
Mr. Payne?
Yes.
Mr. Matheson?
Yes.
I don't know that we can. Okay, so we have a visitor here. I just now looked, and this is a called meeting, and it's got a specific agenda, so we can't add things to our agenda other than what's on there. So we have a Mr. Owens who's here that wants to speak with us, and I had mentioned to him we would entertain him at the regular meeting, and he would really like to speak tonight, but I don't think we can. It's a called meeting. I just looked down and saw called meeting. I mean, I knew it was.
I think am I wrong, any public meeting, we have to be able to have,
You don't have to have a meet, you don't have to have anybody at any time, even a regular meeting.
It's up to us, but I don't know if we don't take any action. I don't know.
No, well, I
If
think
we're
he
not
wants.
taking action on it.
Okay, well, we can entertain it then, if that's okay with the board.
yeah, I would
Okay.
like to, because
I just
I
didn't
know
wanna-
what the topic is, and it's,
Angie will go
Okay,
get him.
I just didn't want to
Yeah.
put something on there that
Right.
wasn't.
As long as we don't
appropriate.
take any action, it's not,
Okay.
it's a call meeting, we can't vote.
All right, good deal.
on anything. If that's understood.
Yeah, this is. Mr. Owens, if you want to just stand right there by the TV and address the board, we'll.
Okay.
Now, we can't, you may have heard in there, we're at a call meeting, so we've got an agenda, but the board wants to hear what you have to say, but we
Okay.
can't take any action tonight because you're not on the agenda for the call meeting. Normal board meeting, anybody can show up, give us one of these, and we can take a look at it.
All right.
Okay.
All right. My name is Steve Owens. I'm active part in my daughter's nonprofit, Women of MC. My daughter sent me here today to speak for the girls of Johnson County, as if I were speaking for her and her friends when they were in school. Since she cannot be here today, every day I deliver emergency care packages that include feminine hygiene products to girls and women across our county. This morning I actually delivered 3 on my way to work. Since school has started last week, our delivery services have tripled. We usually don't have many emergency deliveries, but last week was an exception. Statistically, 1 in 5 school-age girls go without pads or tampons when they need them. Women of MC has worked hard to reach the community as best they can, but the missing pieces are the young girls between the ages of 9 and 17. Many of these girls this age do not have social media, and in Johnson County, many families do not have internet connections. Virtual school has spun this county into a realm of unknown, especially for the young girls unsure of where they can get their next box of pads. Surveys taken from the Women of MC team conclude that school-age girls use toilet paper, socks, and plastic bags to contain their periods when their mom, dad, or grandparents cannot access them. Kids on free lunch meet the poverty line and can get fed at school, but services do not cover pads and tampons. These are outside expenses. Statistics show the average pay per family of 4 is $17. The average box of pads in Johnson County is over $4. Imagine having multiple daughters and a mother trying to manage their expenses of the natural occurrence during these times of COVID. We're asking the school board to consider letting Women of MC donate pads with a guarantee that every girl will get that receives lunch receive a box of pads from us. Period. Insecurity distracts girls from their schoolwork, affects their social life, and overall confidence. In times like these, we shouldn't have to ask young girls 9, 10 years old to reach out and request from their teachers what they need when they need these products. We're expecting them not to be shy or embarrassed as young girls, but most adults in Johnson County have a hard time even saying the word tampon. We ask that school board accept our pad donation and give them to every single girl, assuming that they need them. We have asked the school system to allow us to offer these services, but this response was given that the only way we could give them away was if a girl electronically asked for them, or the girl would have to physically come to the school and get them. We were also told that they could only give them away to the girls who get free lunch, excluding 50% of the remaining female population. This is a free donation, and we would hate to see this service rejected. Instead, we should be celebrating the girls of Johnson County by showing them we care about them. I know it is not atypical for a man to come before the school board about an issue such as this, but together we have to start breaking the stigma around the natural part of life and open to freely giving our kids what they need without them having to ask. Thank you.
Dr. Simcox, do you have any?
Yes, we have been working with this group. Dr. South has with our counselors, you know, and I know they're working on ways to get them out to our meals. And I'm not sure about where the only giving them to 50% of our girls come. That's
I think
everybody here eats is free. So that's not an issue.
I mean, on the school bus, when you're taking them out,
yeah.
they wouldn't reach the 50% of
Oh,
girls,
okay.
is
Yeah.
what I meant by that.
Okay, and then, you know, and that is true, and it would only reach those that get the meals, you know. For those that don't get meals, you know, they can come to the school and get those, pick up those products.
Well, some of them don't have a way to get there.
Right.
And, you know, since school has started, you know, our delivery has increased a lot. And we're just looking for ways that we can, you know, give them the access to it the best way we can.
And I think for us, it would be those that do receive the meals, but, you know, other than that, we wouldn't have a way to access those that.
Once school starts, what would be the options?
Once school starts, we've already got, you know, machines in our schools for the pads, you know,
Are
with our
those free
counselors,
to
and those are free,
children?
with our counselors and our nurses. So once school starts, you know, they will have better access because they'll be in school.
But they don't have to ask, there's a machine in the female bathroom?
There's a machine in the female bathroom at the middle school and the high school. Elementary, I think they have to come to the counselor or the nurse. But at the middle school and high school, we put machines in.
How do you, I mean, I guess you go by a list, you got girls' age and everything to be able to distribute those on the bus?
Now, that's a Miss McCulloch question, because she has the list. You know,
I see.
That would be a question.
Even with the mask, I seen the eyes.
I know Dr. South is working on that right now because, you know, we don't know who all's being fed. You know,
Right.
you wouldn't want to give it to a home that has a kindergarten and a first grader.
Right.
You know, you'd want to make sure you're giving it to the correct home. So I think Dr. South had spoke with you about trying to.
I don't have a problem with that. It's a good idea. It's one of those things that I never thought of.
Yeah.
You know.
I had a daughter that grew up with yours, and I bet me and you both been at the drugstore buying those things.
Well, I never really knew it was an issue until my daughter brought it to my attention. And,
I didn't either, and she brought it to mine too.
And she's been working on it since early this year.
She's very passionate about it.
And she is, and you know, we've worked with a lot of families out there, and you know, it's kind of heartbreaking sometimes to see these girls come, you know, and you're just basically delivering necessities that you would feel that they could get from home, and but under different circumstances, you know, they might. But I'm just saying it's a bigger need than I think a lot of people realize. And, you know, we're just looking to try to figure out how to get to anybody and everybody that needs it.
Okay.
We just need a means to get them there. Well, what about, okay, kids, these girls that are not getting the meals? And I know we can't really make a decision on this since it's not an agenda item, but I'm just asking, would it be possible to have, on the buses, how much trouble would it be to have just those delivered without a meal?
I was going to say, I mean, I could get with the counselors at the middle school and high school, and they could look at our list of students that we are delivering meals to. And I mean, I would think it would be fairly easy just to go over the list, and they would see the addresses that, you know, the students in middle school and high school, girls.
Yeah.
Well, how about,
Anything's possible right now.
Anything's possible. possible.
Yeah. All right, as Citizen Mike here, I would like to ask our director, to see if we can figure that out, and then if we need to make it an agenda item.
Right.
If we need to vote on something at the next
If we make it
meeting.
work with that, come through the board, make it work.
Well, and Dr. South has been working on that with our counselors, so Dr. South can get with Ms. McCulloch. You know, I don't really foresee that needs to come from the board development. We will make it happen. It's just
Okay.
getting the logistics down.
Okay.
Yeah.
All right.
All right, just let us know if
Thank
we
you,
need
Mr.
it.
Owens.
I appreciate it.
Hey,
All
thanks,
right.
Steve.
Do we have a motion?
Hey, I would like to say this, for every parent and every teacher I've talked to, and I've been picking on you principals, I say, well, how's things going with the principal? Everyone's saying, the principal's doing great. The principal's doing everything they can. So just keep up doing what you're doing, and I'm probably gonna get a lot of hate calls and hate emails tonight, but if we had voted to go back to school, I'd be getting them too, so
Well,
just
and
bear with us.
I think most people realize the decision. I wish we weren't in a position to have to make the decision, but we are, so.
And I would like to state, you know, if parents are still having concerns, questions, issues, please call. You know, just call the school. The teachers will help you. The principals will help you. Call central office. We will help you. If you're not having contact from your teachers, call us. You know, we're very friendly. We're very open. We understand the frustrations, but just let us know and give us a call.
Okay.
Well, I think we are gonna get kids back to school as quick as we can,
Yeah.
as quick as we safely can.
Sorry, could we send do another call out, just to
Yes.
remind people they might not have gotten it, or?
Yes.
Is there something you can put in the tomahawk?
Well, Chase actually has, you know, Chase, he's already got us a reopening plan typed out, so we will get that out tonight.
I'm gonna have to tell you, I come through the door ready to vote and go back to school till I heard Wendy, so. Appreciate it.
I wish we could have.
And Wendy, we don't wanna put all this on your shoulders, but it's the facts.
Right,
You
and
know.
I'm a parent too, I'm right there doing virtual homework with a 9-year-old,
Right.
and I'm right
Work
there
all
too,
day,
so.
yeah.
What about Leon?
Yeah, right.
Sorry, Leon. Do we have a motion?
I'll make a motion with
All right, we're adjourned. Come on, Leon.